Hello everyone, welcome to my page. Welcome to Piece of His Cornerstone Assisted Living. My name is Martha Janvier. I am the owner and creator of this facility. So basically I just wanted to clear any confusion, any misunderstandings, any cliches about care homes. I want to differentiate nursing homes from hospitals, from different care homes, and just give you a better understanding of what an assisted living facility is. Before we begin, a little bit about me. I am a registered nurse. I have a passion for the elderly. It was kind of cliche, people, sell that pitch, but I really do. I love the elderly. I see each and every person of age as if they were my parent, my grandparent, and sometimes I forget they turn into my babies as well. That's just the heart that I have for them. But I used to work in a hospital, and a lot of the times I see the elderly there. They need loving and they need understanding. They're not babies, but they're adults, but they're in between because they can't make certain decisions for themselves. And a lot of them are stuck in the middle because they don't have family members or loved ones to come in and take them in to make sure that they have the care that they deserve at home after discharge. Some of them, their hospital stay prolongs, and I didn't like that when I was there. So I acted on it. And I acted on it by starting my own assisted living facility so that, I can make that change, remove them from having to go to the hospital, readmitted, having to go to a nursing home. There's nothing wrong with nursing homes, but not everyone wants to be in an institutionalized setting. What is an assisted living facility? ALF for short. And ALF is exactly what it is. It's a facility where we assist with activities of daily living. Activity of daily livings, just to name a couple, is bathing, assisting with bathing, assisted with feeding, assisting with dressing, assistance with medication, amongst other things. So we don't provide total care. We're not a nursing home. We're not a hospital. We just assist our residents and we help them to be as independent as possible. We try to keep them at their optimal function. Little bit about my facility. We're located in North Miami Beach. Some of the services that we provide, there's a list of them, so I'll let you know. We provide medication management, meal preparation, so they'll have breakfast, lunch, and dinner. And our menus are tailored by a registered dietitian. But because not every person is the same, everyone does not eat the same. So we try to work around what did that person like to eat, what is their cultural preference. So all of that plays a role. What are they allergic to anything? Did the doctor order a specialized diet? So those are things that we take into consideration when we're serving someone. We provide memory management for Alzheimer's and dementia. So a lot of our elderly, they become forgetful. Some have Alzheimer's, some have dementia. Sometimes it's other underlying issues that is affecting their memory. So this is where we come in. We make sure that they don't run away, they don't leave, they don't get lost. We make sure that they don't hurt themselves. We cue them and try to distract them and bring them back to reality, bring them back to safety, bring them back to comfort. And sometimes it's frustrating for them because they can't remember what happened 5 minutes ago. Some can't. Some will just have a conversation with you and flat out forget who you are. So we try to bring them back to comfort. Another thing that we do is staff queuing, exit seeking, agitation management. You have someone that has dementia, Alzheimer's, they will get agitated. They will want to leave. So we want to make sure that we know how to address that before something dangerous happens. We just distract them. We make sure that we get to know them personally so that we can distract them by talking about a favorite movie that they had, a favorite song, or bring them to the kitchen. Hey, let's make this meal. We just bring them back to reality, bring them back to a comfort level, a pastime that they had. We have educational sessions, so we are always educating them about why they should take their meds, and um, why we're checking their blood pressure, what's going on. This is just something that's add on, because just because they're aging, just because they need our assistance, doesn't mean that they don't have a mind of their own. They still have a mind of their own, and it's up to us to keep them as independent as possible, make them feel like the adults that they are. Housekeeping and laundry, linen services, we do that. We schedule transportation services. Before COVID, we did more social events. Right now, we make sure we still have social events, but we still follow safety precautions. We have an in-home physician that comes in and see the residents as needed and on a monthly basis. We have 24-hour security cameras, just to make sure everyone's safe, just to make sure that although the caregivers are doing an amazing job watching over our residents, we also have that extra security on the doors. When the door opens, we know when someone's out of bed. We have bells for our residents. They ring the bells, although they don't like doing that. We always let them know, just ring the bell. We have Wi-Fi cable. We have group exercises, daily arts and crafts, music, karaoke, daily games, board games, spa care. So we love to take care. I try to, as the owner, just as I would take care of myself and my family members, I'm going to do the same for each of my residents. I get my nails done, their nails will be done as well. I do my hair, their hair will be done as well. So I do believe upkeeping makes someone feel even better. Birthday celebrations. We're gonna start getting into daily gardening soon. Movies, we watch movies with them, and we bring in volunteers that can talk about topics that may be of interest. So all of these things are included in what we offer. Of course, everyone's different. There's some residents that don't want to do any of that at all, and that's okay. They can do what they like to do. So how our facility is set up, we're not an institution. We're not just four big white walls and it looks, everyone's in uniform, and you have strangers coming in and out. It's a residential assisted living facility, meaning on the outside it looks like a home, on the inside it looks like a home. It's beautifully set up. I made sure I set it up just the way I would want to live in. So when our residents come in, it feels like a home away from home, and that's the goal. I want each resident to feel like they're not at their personal home where they used to live, but they're somewhere else that can remind them, give them a piece of home. And we always let each resident know that they can bring in pieces that they have, photographs, art, bring it in your room, customize it. We allow it. So that's just a gist about assisted living and what we offer. If you have any questions, any concern, please send me a direct message. You can also call me 954-266-8108, or you can email cornerstonehome91@outlook.com. And thank you for listening. Have a good day.